Hello, ma'am. Ma'am, you're
Oh my God.
thank God, ma'am.
Thank God.
Good evening, ma'am.
Good evening.
So, shall I introduce you?
Yeah,
Or did I
sure.
should inform
As you
topic?
wish.
Okay. Uh, I would like to introduce Dr. Remya, ma'am. The First of all, she is the Ayurvedic practitioner. Um, she has pursued her BMS in Vaidyaratnam Ayurveda College, PG from Government Ayurveda College, Trivandrum, PhD in DOB from Rajasthan Ayurveda University, has 21-year experience of clinical practice and 16-year experience of teaching. Other than that, she has authored many books of Sebeba publications. She has been doing research in Ayurveda with Dr. Rajkumar sir since 20 years to understand, apply the principle, and to reverse the disease in appropriate manner. So, heading toward the questions, ma'am, as today's topic is scope of the Ayurveda in modern age, how can we originally estimate the scope of medical system?
Hello, Sonal. Namaste, everyone. It's my pleasure indeed again to join live with Dr. Sonal. And what I understand about Dr. Sonal, she's a great aspirant of Ayurveda and SBBA, and I wish her all the best. So this is our first live together, and I'm sure even though there is a starting trouble, everything went well by the grace of God so far. So the thing, thank you for that good introduction about me. So it is only my duty and responsibility. Whatever she has told, nothing beyond that, just my humble duty and responsibility. And this topic is very interesting topic. So this topic selection has been done because even though there has been so much of discussion regarding various aspects of Ayurveda, this kind of scope of Ayurveda is not discussed on the point. Actually, when a topic is, why a topic is selected? When a topic is selected, there should be serious discussion in the topic. Not, you cannot be going anywhere around. You should be staying in the topic. That's why this topic has so much of relevance. So regarding the scope of Ayurveda, let me ask you one thing. How can we estimate the scope of a medical science?
Ma'am, by practicing in precise manner,
Yeah. So
by
scope of a
practicing
medical.
scientifically.
Yeah, please continue. Please continue. Whatever.
Yes, ma'am, as I learned in SBA, how to practice scientifically or with proper application of the principle by applying the principle as it is, which are mentioned in the our ancient text of Sanhita, Ayurvedic Sanhita.
So actually, the scope of Ayurveda can be estimated in one word through beneficiaries only. Who all are the beneficiaries of the medical system and what is happening to them? By analyzing the impact of a medical system in the beneficiaries, only we can analyze the scope of a medical system. So let us analyze who all are the beneficiaries of medical science Ayurveda. Number one, the faculties who are teaching and practicing. So faculties and practitioners are beneficiaries of the system because this system is the basis, fundamental basis for their profession and livelihood. So they have certain responsibilities towards the system, and they are the beneficiaries of the system, right? So one
Yes,
beneficiary
ma'am.
is Ayurveda physician and faculty. Number two, students. Students are always beneficiaries because they are securing knowledge right from the first year of BAMS. They are securing knowledge of Ayurveda. So always they are receiving this amazing, brilliant science of Ayurveda. They are intended to receive. So they are beneficiaries. And number three, most importantly, the public and the patients. Patients and the public who all are seeking services from this system. So, who all are seeking services from Ayurveda for their healthcare in the matter of treatment or prevention or whatever it be, they are the third category of beneficiaries and most important categories. So, to analyze the scope and number four, yes, I missed that, the entire nation, the impact, the entire nation, India, our country is India. So, India is another beneficiary of Ayurveda. So, I repeat, there are Ayurveda doctors and faculties. There are students who are the beneficiaries. There are patients and public, general public who are the beneficiary. Need not be a patient always. One who is always interested in Ayurveda will always try to seek information and try to adopt various principles of Ayurveda in their health and disease. So they are beneficiaries. And number four, the whole nation. So we can analyze the scope of a medical science only by analyzing individually the impact in each of these categories. What is happening in students after learning BAMS or after learning professional Ayurveda? What scope they are acquiring? There should be a proper study done among the student community to understand what is the scope of Ayurveda among students. By learning Ayurveda, by understanding Ayurveda, how much they are able to incorporate Ayurveda in their day-to-day life, not only in learning, in their living, and also in their experiences in finding patients, and also in their experiences in understanding the physiology, pathology, everything in live environment, not in lab environment. That is one thing. And second category, faculties and doctors. How can we understand what is the impact scope? You have to conduct a survey among doctors and faculties. Everybody will say that Ayurveda is really good. Ayurveda has so much scope. That is a very blank statement. Anybody can say that Ayurveda. But being a professional of Ayurveda, being a professional faculty or physician of Ayurveda, he must exactly be able to say what scope of Ayurveda he has discovered in his life and profession. Only if one is able to do that, or many faculties or physicians are able to do that, they can be considered as, that can be considered as valid feedback. And patients, of course, there should be a proper feedback mechanism from the patients in every college, every clinic, every hospital. What is happening in acute diseases, infections, chronic diseases, how much time period it is taking, whether it is, two things are to be checked for. One is transparency, second is reproducibility. Whether transparency, what the physician is doing, whether he is able to communicate with the patients. Number one, openly communicate with the patients. And number two is predictability and repeatability. Whether the physician is able to predict what the impact of his treatment in patients. If he is able to do that, definitely he is acquiring the scope. And the patient is also going to what you call avail the benefits of Ayurvedic science. So there should be rational policies. So first thing what I will say is, it is the activity of Ayurveda practitioners that determines the scope of Ayurveda. Activity of licensed qualified practitioners of Ayurveda. Second, rational standards, how they are diagnosing, how they are treating, whether they are adopting any uniform standards to understand a disease, to understand a disease process and to reverse it. Number three, how the patients are responding to their treatment, whether they are responding in fast and intended manner. That matters. And number 4, policies of research and education. Policies of research and education that determines the scope of a medical science. How much research is constructive research is happening in the science of Ayurveda. That determines the scope of the science. How much education, how much quality education. What do you mean by quality education means? It will emerge quality professionals. That should be the aim of quality education. So these are the various factors that determine the scope of a medical science.
Does ancient science of Ayurveda has
I'm
any
sorry, Sonal, there is a
significance
disturbance.
in the stand-alone management of modern day diseases?
Yeah, I can hear. You can tell.
Hello, ma'am.
Yeah, yes, please.
Okay. Ma'am, does this ancient science of Ayurveda has any significant role in the stand-alone management of modern days diseases?
That's a good question, because ancient or modern, science is science only. Mathematics is how many years old? We know. Astrology is how many years old? We know. Astronomy is how many years old? We know. Geography is any science, physics, how many years old? So a real science, it is not the number of years that determine the quality of a medical science. Rather, the precision, the accuracy is what is deciding the quality of a science. Science in general. And coming to medical science, it is a science which is intended to, am I audible?
Yes, ma'am. Yes.
Okay. It is a science intended to handle human being. Is it not? It's a science intended to handle life and the living. So man in olden times and modern times fundamentally is man itself. There has not been an addition of a new organ or deletion of an organ or deletion of some physiological functions or addition of physiological functions. How a man was consuming food, digesting food, metabolizing food, excretory, drainage mechanisms, immune mechanisms, everything standardized inside the body. External environment and external circumstances can vary, but the nature of response of human being to variable circumstances remains the same. And the structural and functional components, fundamental components in human being also remains the same. In modern science, it is cell that is the fundamental unit of the body. But in Ayurveda, it is not cell. As you know, it is doshas, the Panchamahabhutas, which is doshas, which are comprising of Panchamahabhutas, are the subtlemost units. And every cell has got tridoshas. So as long as man exists in the form of man, these things cannot change. And the way of response to external environment also is very much standardized. So those mechanisms are explained in Ayurvedic science. So there is no question. That is why Ayurveda is considered as Nitya. Always, there is no question of perishing of science of Ayurveda, because it has got logics, sutras, tattvas, siddhantas, all these no theories. Theories means that is the difference between theorems and theorems. Theories. Ayurveda does not have any theories. Ayurveda has got only theorems. What is the difference? Siddhantas. परीक्षगेर बहुविधम परीक्ष्य हेतुभिर साधयित्वा स्थाप्यते निर्णयः. That which are experimented by multiple scientists in multiple times in multiple eras and substantiated by cause mechanism effect relationship. They are called as theorems. So it is deterministic science, not a probabilistic science like modern medicine. Can be, cannot be, may be, may not be. There are certain tools and methods which are explained to understand, to evaluate, to appraise, to judge, to predict within the science. Within the science. It is not by probability statistics. It is lying within the science. So Ayurveda, as long as man exists as man, is valid.
Okay, ma'am. So, ma'am, my next question is, How can Ayurvedic physician improve their standard of living by advancing in career?
Improving
Their living by advancing in
living.
career.
Okay, that's a good question. When it is not like by doing business, of course. Nowadays, what doctors, I think now in Ayurveda, more entrepreneurship is encouraged than education. Entrepreneurship, everywhere, entrepreneurship is being discussed. How to become a businessman, how to earn money by Ayurveda. That's what most of the workshops are focused on. This is not the real way. Actually, our acharyas have told the real way of progress by a profession, any profession. Let it be doctor or engineer, whatever it is. The fundamental principle of success of a profession is explained in Ayurveda. What is the shloka? Vrityu vayer nisheveda yesyur dharma avirodhina shamam adhyenam cheva sugha eva nishevade. What kind of profession will give you happiness, will give you professional satisfaction? Yes, your dharma avirodhina, that which is not contradictory to dharma. Dharma means that which is imparting social, self and social well-being. That is dharma. So it should not be contradictory to dharma. Shamam means that which produces peace of mind to the learner or the person who is practicing. Adhyayanam, most important, that the profession which enables a person to constantly learn throughout his life. How much blessing it is. When you are entering a profession, you are exposed to the possibility, chances, and circumstances to learn throughout life. Shamam, Adhyanam, Jeva. So these two, Acharya didn't mention Dhanam because this money is the byproduct of profession. It is not the product of profession. Money definitely it is required, but it should not. You should not be doing, especially medical profession, should not be intended for money making only. Money is the byproduct. It should come naturally in its course. We are meant to do a profession. In Ayurveda, it is mentioned as we are supposed to follow dharma, ethical code of conduct mentioned for a physician, student, faculty, every category. Acharyas have mentioned code of conduct, how a physician is intended to be, how a student is intended to be, BAM a student, how a faculty is intended to be, how a scientist is parikshaka gunas intended to be. All these are explained in the science. Why our ancient scientists have explained this much? Because they wanted us to implement all this in our real life. So actually, livelihood is matters a lot, but secure livelihood comes by good learning, good understanding, good code of practice, compassion for the patients. Primary thing is putravat samubhajare. You have to consider patient like your own son. How our son, when our son gets sick, how much tensed or worried we will be. The same kind of compassion and anxiety in positive way should be there for the patient. So our first priority should be healing. Healing means not benefits and risk. Healing means sughayacha. It should be health. Health is the target. So sugha sapnyagam arogyam, right? So for that we should be working for, and money has to come by natural course as a byproduct, not as a product. But right now what I feel is business is being promoted and not science and education. This is where we are failing. That's why Ayurveda is no more counted as a medical science in other parts of India. I mean, other countries. In India also nowadays it is not considered as a medical science. It is considered as an alternate tradition, etc. So this is very pathetic going. What we are doing right now, we have to change direction.
Yeah, thank you. So, ma'am, next question is: does medical tourism contribute to the scope of medical science?
Definitely.
And if yes,
Yeah. My answer is yes only. Medical tourism means what? We are extending our knowledge. We are extending and exchanging our knowledge and services to globally, to every part of the world. In an authentic manner, we should be promoting medical tourism. It's not like some package treatments or what you call, nowadays it is deteriorated to a worst level. It's not like spa, medical, what you call beauty treatments, something which is not even explained in Ayurveda is being done, which is not authentically directed is being done. Medical tourism means two things: exchange of knowledge and making services available to whole world. What kind of services? It should not be like what you call quack services. It should be authentic medical services. How can we promote authentic medical services reaching all over the world? We can do that only by improving the. There should be audit, right? There should be clinical audit. Clinical audit means there should be standards, accepted standards of quality in decision making process, clinical decision making process. Every doctor in every part of India should be doing a uniform way of decision making in all diseases. For that, there should be rational standards, and we have to compare whether we are meeting that rational standards in our practice. There should be a comparison between the standards and what we do. What we do today and the standards, whether we are able to meet. Nowadays, we are checking for NABH accreditation is being done for hospital hygiene, equipments, quality of equipments, everything we are analyzing quality. That is fine. But quality of decision making is what is going to create impact in the patient. Rest everything is fine. See, we are making, we are giving a luxury setting to a patient, but we are unable to heal the patient. Is it fair to the patient? So
No,
medical
ma'am.
tourism means we should be able to put our signature, Ayurveda signature all over the world. Ayurveda doctors must be brand ambassadors of authentic Ayurveda, scientific Ayurveda. When a patient comes to us, nowadays Modi ji has encouraged visa. I have read it. Medical visa is being encouraged. That's a good thing. But Ayurveda physicians must understand that it's not a means to make money. Money is always a byproduct. It's a means to authentically prove, establish, and to reach Ayurveda, to enable to reach Ayurveda to different parts of the world. For that, we should have standards first. We cannot do it without standards. So, to medical tourism, when we see nowadays people are coming to India for knee replacement, liver transplant, many surgical procedures. Why they are coming to India? Because it is comparatively so cheap. And what government is thinking is Ayurveda can be considered as integrated alternative medicine. The way any system will get the best results when it is used independently.
Only madam will come to the line.
Okay, ma'am.
Accepted then. Invite madam to your video. Then madam will accept. Then automatically she will come.
Okay, ma'am. Okay, ma'am. Thank you. Good evening, ma'am.
Good evening.
Uh, Good evening, everyone. I am Dr. Sonal from Maharashtra and a member of Team Yatharth both. As we discussing about the scope of Ayurveda in the last session and were interrupted by technical difficulties, we'll continuing the same session today. Once again, we are blessed with the presence of beloved Dr. Remya ma'am as a guest. Let me introduce you, ma'am. Dr. Remya ma'am is Associate Professor and HOD of Ravegun Department of Rajiv Gandhi Ayurveda College, Mahe. Did her BMS from Vaidyaratnam Ayurveda College, PG from Government Ayurvedic College, Trivandrum. She did her PhD in the subject of dysfunctional uterine bleeding from Rajasthan Ayurveda University. She has more than 21 years of clinical experience and 16 years of teaching experience. She authored the books. First one is Evidence-Based Ayurveda and Rational Prescribing. Ayurvedic Gynecology, Devised and Updated. Third one is The Mission of Science in Medicine. Fourth is Ayurvedic Gynecology and Maternity Care. Fifth one is Dravyagun Algorithms and Clinical Decisions. Dr. Remya ma'am along with Dr. Rajkumar sir had developed methodology for standardized decision making in Ayurveda called Evidence Triad Approach for implementing scientific practice of Ayurveda. They are conducting CMEs and workshops called SBA Wisdom Series. So, as ma'am, before starting this session, can I go through the points discussed in the last session?
Yeah, sure. For the sake of new and old audience.
Ma'am, as ma'am had explained in the last session, that the scope of medical science can be estimated by analyzing the impact on the beneficiaries. So that includes first one are faculties and practitioners, as the system is the basis for their professional and livelihood. Second beneficiaries are students. They are securing knowledge of this amazing science of Ayurveda. Third one, the public and patients, as they are seeking service from the system for their health care. And fourth one is nation. She also put light on the way of analyzation in these four different categories of beneficiaries. First, students should be analyzed by their ability to apply the learned theories. Second, faculties by his contribution to Ayurveda science in their career. Third, patients by analyzing the transparency, predictability and repeatability. She also emphasized on the importance of the creating and following the uniform standards to understand the disease process and to reverse it in faster and intent manner. All these will form the basis of research and education policies only. So, one more thing to add, and for quality education of Ayurveda, series of more detailed and brief session are conducting by Yatharth board team on Insta Live on the topic how to learn to understand Ayurveda, and it uploaded on YouTube also. So next question was the next very relevant decision was about, wait a minute. So the second question is, how can Ayurveda stand alone in modern days diseases? So ancient science stand alone management of modern day diseases as basic fundamentals and nature of response to the external environment can't change na. So as long as man exists as a man, that's why Ayurveda is nitya, and there is no question of perishing of science, because it has a sutra, tattva and siddhantas. Siddhantas means the theorems. Theorems are experimented by multiple scientists by multiple time in multiple eras. So by cause, mechanism and effect relationship only. So Ayurveda is nitya. With the very beautiful reference of Samhita, ma'am threw light on the standards of living of physician. We should be not money based. it should be focused on dharma, means or ethical code of conduct, as mentioned by the acharyas. We all we all we all have to be satisfied, and self and social well-being should be there, peace of mind should be there, and the one who enable the person to learn throughout his life. This is the most important thing of learning shastra. This was this was everything was discussed in last session. So now, ma'am, let's start the session with the question.
Yeah.
Okay.
Yeah, sure.
So that one left in last session. So, ma'am, does the medical tourism contribute to the scope of medical science? Your answer is yes, but how?
Medical decision, right?
Tourism.
Medical tourism. Okay. I think we have started that point last time. Yesterday, day before yesterday. Medical tourism is really important owing to two reasons. One, we are exchanging knowledge of a system of medicine, Indian system of medicine, a particular knowledge. Nowadays, what Western countries consider Ayurveda, even Middle East, they consider Ayurveda as a tradition, but they don't know even that Ayurveda is a science. They consider it as a tradition. What is tradition? Tradition means a set of ideas, beliefs, culture, practices transferred from generation to generation. There is no basis. Actually, for tradition, there are no questions why and how. Nobody should question tradition because it is a sort of belief-oriented practice, or a group of people practicing a particular thing, like heard from their forefathers. During this period, this has to be done. After pregnancy, after delivery, this is the practice. Or during pregnancy, this is the practice. So it is like a what you call belief system. That is what tradition is. There is no rational knowledge. Knowledge means always it should answer the questions why and how. These are the two crucial questions which differentiate knowledge or science from tradition. As you know, science is derived from the word scientia, which means knowledge. So knowledge is authentic. Knowledge is information. But for knowledge to become authentic, it should have its own ability of transparency. Transparency means why and how should be answered by the logics of that science. We know that we have studied science in 10th plus 1 and plus 2. We have studied physics, chemistry, biology, mathematics. How we understand that it is science? Because we learn the theory part first, we go to lab, we do the experiments to verify the logics which we have studied in the classroom, and we verify it, and we finally conclude that these theories or logics, whatever, we have got these observations, so it is correct, it is verified to be true. In the same way, Ayurveda is science of man, so it can be verified. It can be verified, demonstrated, truths are explained in the science. It is not belief or culture or what you call ideas or practices, blind practices. It's not like that. We know that being a student of Ayurveda, PG scholar of Ayurveda, you know that there is a very innate precision, certainty, rationality, etc. for the science. That's why it becomes more complicated and subtle. Anybody cannot practice Ayurveda, right? Anybody can practice tradition. Once you are learning that particular medicine in that particular, for example, some traditional Vaidyas are practicing for jaundice. They are giving the same medicine for every case of jaundice without analyzing the cause mechanisms in the patient. So that is what demarcates from science and tradition. So medical tourism, first of all, exchange of authentic knowledge of Ayurveda. That is most important. Nowadays, that is lacking because Ayurveda doctors, so-called qualified doctors, are going abroad and they are ready to teach any community of people anything as Ayurveda. First of all, there is no confirmation within India regarding the objective standards. So science means it has got objectivity. It has got clarity and objectivity. It's not like in my perspective, things are like this. Your perspective, things are like that. So it cannot vary from person to person. There are certain objective standards to be adopted to analyze a situation, and that is what science is. So such standards are not discovered, established, and what you call practiced in India. Worst of all, such objective standards which are based on Shastra Sahita Tarka, science based reasoning. That is what Shastra Sahita Tarko Sadhananam, the best tool. Our ancient scientists have told the best tool to evaluate, appraise whether what we are doing is correct or not is Shastra Sahita Tarka. Right. So Tarka means reasoning. Reasoning done based on inbuilt logics in science. So there should be inbuilt logic standardization, rational standards. They are not emerging in India. Then whatever we are learning in colleges, everything for personal variations can happen. What I understand as pradoshas or something else, avarana or samadosha, whatever it is, will be different from what other persons are perceiving. So there is a huge variability in understanding of a subject between different practitioners of Ayurveda in India. There is no uniform understanding. There is no uniform comprehension about a topic. So when infection, what is infective fever, how COVID-19 is to be deciphered, 100 people will give 1,000 opinions. In my opinion, it is Vada Kabha Jwara. In other persons, it is Agandu Jwara. In other persons, it is what you call Kabhadiga Pradoshaja, something else. It is stupidity what is going on. So there should be standard. Then only we can communicate, exchange knowledge with foreign audience. And that is one thing. When you are going abroad and teaching someone, first of all, they should know Ayurvedic biology. And Ayurvedic biology cannot be taught in a classroom like without any, in an unprofessional manner. Nowadays, so much of certificate courses are emerging in Europe. Europe and Middle East, I don't know. Europe, it is emerging. Anybody can become Ayurvedic lifestyle consultant or Ayurvedic nutritionist. These are all like Ayurveda doctors. When they are starting such courses in abroad, perhaps they may be getting some fans and audience and what you call patients for getting wellness therapies. But they must remember one thing. It is like equivalent to committing suicide because they have studied this much hard, they have got qualification, and what they are doing abroad is just selling it for the sake of anyone who has no basic knowledge about the subject. So they can conduct 3 months course, 6 months course. People will be attracted to anything belonging to India. That is the peculiarity of India. They know that India is rich in culture, what you call all these things, knowledge systems, everything. So naturally, even same for astronomy. I mean, astrology, classical dance, classical music. So many Western people are coming here. They are very much interested. They are learning with so much dedication, more dedication than how people here are doing. So that can be utilized in a constructive way. How it can be done? First of all, the government of respective countries, they should initiate professional education in Ayurveda in these countries. If their citizens are really interested to learn, understand, and professionally practice Ayurveda in Europe, what should happen first? First of all, the government should understand. They should give a proposal to government showing their interest. And government should ask question to India, government of India. It should not be like secret courses done by certain legends, secret courses. And worst of all, meditation, spiritual practices, all these things are mixed with Ayurveda. As if Ayurveda is something like a spiritual science. Originally, Ayurveda is a rational science. It is a deterministic science led by deductive reasoning. So knowledge-wise, so much of misled propagation is happening, and therefore in India also these foreign people can come here, they can join. I really appreciate foreigners who are taking initiative to join proper Ayurveda colleges and learn BAMS because that's really an appreciable thing. They don't want to do that. Many people are just, they want to do some secret courses. Here, Indians are looking for money only, Indian doctors. They are ready to do like Nadi Chikitsa. What is this Nadi Chikitsa? There is no Nadi Chikitsa in Ayurveda. There is only a diagnostic aspect. One single entity is Nadi. There are several other entities. So everything is getting misled. And coming to treatment nowadays, our Honorable Prime Minister has introduced tourist visa, medical visa also. So people can come here. Definitely they can take the advantage of this science, this medical science. But for that, we should know how to give justice to these people. They are coming after, many people are coming for wellness therapies. It is high time to demarcate wellness therapies from Ayurveda, because Ayurveda is not something which is intended for wellness. It is intended for health, and wellness always naturally follows health, right? If there is a disease, it has to be reversed to health. And if there is no disease, just some basic lifestyle advices will ensure that it will be stabilized. So there is no question of what you call wellness therapies, and panchakarmas are being misinterpreted as detoxification. Panchakarma is not detoxification. I have a video in my YouTube channel regarding this. Anybody who is interested, who wants to do panchakarma as detoxification, can visit that video. Every details are explained, that why and how panchakarma is not detoxification. It is as serious as surgery, a very serious procedure which has its own indications and contraindications, and not intended in more than 98% of population today, whole world population today. So this kind of activity, so what we can do is, once objective standards emerge in India, education quality will be different. Then these Ayurveda doctors will not go abroad to do some quackery. They will stop doing that, because they understand that this much valuable science we are trained in, we are learning. They can see that in their practice, the difference. What is happening today, like mixopathy or prescribing modern medicine, etc., will stop. These Ayurveda doctors, physicians, will learn to stand on their own feet. And once they learn to stand on their own feet, they become professional. That culture of professionalism will emerge. Then they will stop propagating these things, going abroad, 3 months course, 6 months course, consulting patients and doing wellness. Why should we treat patients in a country where Ayurveda is considered as an alternative? That itself is biggest insult to Ayurveda community. Why should we go for a conference and speak on traditional medicine and alternative and complementary medicine, when we know that Ayurveda is not that? Ayurveda is scientific medicine. If I am invited for a conference in traditional and alternative medicine, I will write to the organizers, sorry, I am not meant to do this. Ayurveda is not in this category. It does not belong to traditional and complementary medicine. Please correct yourself. And if you are ready to call me for scientific Ayurveda sessions, I am happy to join you. But this kind of realization is not there,
Not there.
Sonali, you might be thinking the same, right?
Yes,
People are
ma'am.
sharing their Facebook posts. I have been to Germany, I have been to Switzerland, talking about traditional medicine, complementary. I feel ashamed. They are distorting things. They are meant to be originally punished, because they are distorting the very identity of a system. How much efforts are done by our ancient scientists to emerge these theorems, these logics, these principles. And because of inability of modern age faculties, modern age scientists, modern age students, it is not their problem, it's not their flaw. It is happening for centuries, because their faculties are not able to convey the truth. They themselves are getting incompetent. So this situation should change. Then we can do wonders. We can do wonders, because knee replacement or uterus removal, hysterectomy intended cases, we can prevent these surgeries. Wherever surgery compulsory in modern medicine, these foreigners are coming for cheap rate surgery in India, because in India surgery rates are low. When they come to SBBA practitioners, we can avoid that at a rate 1/10 of what Western medicine is doing by surgery, less than 1/10, as you know.
Yes, ma'am.
You being in team SBA. So this you can imagine that wide difference. Our national economy will improve, and these foreigners will understand the real value, potential, and scientificity of Ayurveda. They will want their next generations to learn Ayurveda as a science. They will give proposal to government. I'm telling at least in a period of 10 years or 5 years or even 2 years, it can happen with SBA. They will give proposal to government to initiate Ayurveda medical colleges in Europe or somewhere abroad. This is what real progress is. Nowadays, what is happening is mere business. You cannot emerge a science by business, especially medical science. Medicine is a mission and not a business. That is my point.
Yes, ma'am. But ma'am, Wikipedia addressing Ayurveda as a pseudoscience, no? So does that mislead people all over the world?
Wikipedia, how they can be sure that they are not pseudopedia? We cannot be sure. No, Wikipedia, authenticity of Wikipedia is very bad. It's
Yes,
not
ma'am.
genuine because it is first of all, it is a user generated source of information. Wikipedia is not written by a authentic person or some authentic group after conducting research in a particular topic for a long period and arriving conclusions. Anybody can edit Wikipedia. Okay, anybody. If you want to change, you can also change. I can also change. So that brings out clearly how valid Wikipedia is. So pseudoscience written by Wikipedia doesn't cost anything to us, but still we can question it. If we have to question it, we have to legally question it. That's what I think. And anything which is addressed as pseudoscience by them will not become pseudoscience at all. It's very simple because, and they are having some what you call motives also. These Wikipedia makers, those vandalism can be there, like destructive motive, destroy a particular. They can write anything. Vandalism is one factor. So such things are there. So you cannot consider Wikipedia. If anybody is telling you that your science is considered as pseudo in Wikipedia, you can give the same answer. How do you establish that Wikipedia is not pseudo? That will clarify him properly. Let him bring evidence to prove that Wikipedia is authentic. Then we'll see.
Okay, ma'am. Ma'am, what is the role of BMS students, physicians, and faculties to emerge the real scope of Ayurveda?
Very good question. That's what we were. You are telling about 3 targets: students, faculties, and
Patients.
patients. So patients are beneficiary side. Students and faculties in the left side. They are supposed to make the change in the society regarding how the impact of Ayurveda is to be determined by students and faculties, and of course clinicians. Students are going to be clinicians or faculties or scientists, whatever it be. So first of all, what is to happen is Ayurveda is to be first of all recognized as science-based medicine in India. Ayurveda is to be recognized as science-based medicine in India. When that day happens, it will be a golden era. It will be the beginning of a golden era for Ayurveda and healthcare of India, healthcare system of India. Because nowadays, as objective standards, as I told you, what is science? Clarity, objectivity. There should be clarity regarding the science, the scientific knowledge part. Why and how should be answered properly. And number 2, objectivity. Objectivity means there should be particular objectives. What is to attain? For example, pandemic came. What I understand is nowadays, always when disaster happens, or in Kerala floods came in 2018. So when people are in need of medicines, when people get stuck somewhere because of flood, many people were suffering a lot. There were so much of camps, rescue camps, rehabilitation camps, and all these camps, whatever I was surprised to see this. They were asking for medicines. Okay, if anybody is ready to donate medicines, they can donate. and all these medicines were modern medicine. I was wondering, like the anti-diarrheal medicine, ORS solution, then fever medicine, even Dolo, then dysmenorrhea people, they were having needed painkillers, everything modern, antifungal creams, then everything anti medications of modern medicine were asked for in the list. Kindly provide urgently these medications. I was wondering, Ayurveda is not a medical science here. Is Ayurveda not a medical science here? Nobody is even talking about what Ayurveda doctors, how they can provide the, or any name of any single medicine or any medicated water herb was seen in the list. Always modern medicine list was being circulated. And when pandemic came, we know that how hard we had to fight for our own survival. For our own survival, we cannot independently stand on our own feet and establish our potential, scientificity, and confidence. Just imagine that pathetic situation. Ayurveda being an Indian system of medicine, we being the authentic practitioners of Indian system of medicine, we had to fight hard for our own survival, still fighting hard for our own survival in India. Just imagine that situation during pandemic period. We were forced to do many things which we didn't want. We wanted to do many things. We wanted to do many things independently which we were not allowed. Why such situation happens? Such situation happens because Ayurveda is always considered to be secondary. value, not primary. Always modern medicine is considered as, conventional medicine is considered as mainstream. Why? They themselves have declared, because all over the world modern medicine is there. So they themselves have taken the, what you call, monarchy, or they have declared themselves that we are having authentic standards of management, diagnosis. So as we are accepted globally, ours is the main system of medicine. So they themselves have considered it. They themselves are told that this is what scientific medicine is. Their scientific medicine begins from unknown compound. Does any citizen of India know that their scientific medicine begins from an unknown compound? Unknown compound, trial and error is done, benefit risk hunt is done. So scientific means knowledge-led medicine. There should be a knowledge to substantiate the medicine, use of medicine in the particular condition. Also, there should be reversal of the disease. Secondly, and most importantly, there should be a knowledge to support the use of medicine to reverse the particular cause mechanisms of the disease in the patient. Is there such a thing in modern medicine? Always it begins from unknown compound, benefit risk, verification is done. But they consider themselves as scientific medicine based on inductive reasoning. So what happens is, the entire definition of science is distorted by modern medicine, I would say. What Einstein is, Albert Einstein, he himself had told that science is the process of refining everyday observations. Refining the knowledge of everyday observations. Is it happening by these biostatistics? How can you refine your knowledge? If there is a knowledge only, you can refine. No. When there are only observations, how can you refine observations? Observations are external. Knowledge is internal. There should be logics to answer how, why, what, when, where, how it can be here, how not here, why not there. These should be answered. Without that, one unknown compound is introduced and telling that we have scientific medicine and everything else is unscientific. So nobody should practice this. Everybody should adopt modern medicine only for such and such pandemic. There is a particular ministry for Ayurveda also, Ayush system. So Ayush system has to strengthen, right? Ayush system has to strengthen. For Ayush system to strengthen, they have to adopt policy making revision in policy making. Existing policies have failed because we were not able to stand on our own feet independently during a pandemic. Our rights were denied. Our rights were denied. We were ready to help so many people during that worst period, but we had restrictions. So for this to happen, we need support of government. We have to go hands in hand with government. If government is of the people, for the people, and by the people, definitely government must listen to those people who are telling about renovation. What renovation is crucially required. They should be ready to call those people. Yes, we have solutions. Our solutions may be different from the convention, but we have solutions. Please call us. We have given so many proposals from SBB. They should be receptive, because pandemic or crisis is a period where receptivity should be maximum. Receptivity is very important during a crisis. Then only solutions will emerge. We were unfortunately, we were suffering a lot. You know that better. So this is how students should study properly. Objective standards should emerge. Reformation of educational policy is required. That is also proposed by SBA. How education should be revised. Professional education of BA, MS, MD, and PhD. Research proposals. We have given research proposal. Me and Rajkumar sir are there in the expert team of standard treatment guidelines in musculoskeletal disorders, appointed by Ministry of Health. So we have given proposal how to revise the standard treatment guidelines based on the principles of science-based medicine. But no discussions are happening. So this is the underlying problem. The receptivity should change. And definitely that will improve the quality of medical services in the nation. Ayurveda medical services. When students start knowing better, physicians will do better without mixing with modern medicine, without mixing 5 medicines or 6 medicines. They will be able to get on the target results with minimum medicine, FDA approach of Ayurveda, fragmented dosage approach of SPEDA, and one medicine scientific diet approach of SPEDA. Then what will happen? What will happen?
The cost of the medicine will definitely reduced.
So man days will be saved. People will get well very fast. Once a cold develops, it will not land in pneumonia. Once they start doing unscientific diet, paracetamol and other things, definitely there are chances for escalation to pneumonia. But we are taking care of the patient in stage 1, innate immune system. We are modifying the innate immune system in favor of the subject. And we are enabling
by
the patient
activating
to get back.
immunity. Yes, ma'am.
Right. So we are enabling the patient to get back to health. So not only that the patient is getting free from post-COVID illness, he is getting back to health, his metabolism, drainage mechanisms, everything, immune system, everything is getting more efficient, which means he doesn't require long leave. His man days are saved. His chances of getting heart attack, dyslipidemia, stroke, hypertension, and other things, hospitalization by heart attack, etc., will be very much low, because his metabolism we are improving, his circulation, drainage mechanisms. So what will happen? The man days will improve. National economy will improve. This will happen in 1 month. We can show the results. It's not what we require 6 months. If government of India is ready to give us an OPD, not even an IPD, for 1 month, we can prove the scientificity, the innate rationality of the science of Ayurveda. So we can prove that, and public will get immense benefit by Ayurveda. Right now they are spending so much. Today also one patient came to me, she was telling me, she was for fertility treatments. She was telling me in Ayurveda hospitals, she had spent more than 2 lakhs. Different hospitals, per hospital more than 1.5, 2 lakhs for Panchakarma and other things. And at an age of 41 years, her levels are AMH level, etc. is very low. So now after doing 2 weeks of stage 1 SBBA, today I checked her AMH. It was 2.4. It was 0.3 before 2 weeks. I'm not advertising my efficiency or something, my ability or something. I'm telling the real potential of science. 2.3, even I got surprised. I thought about 1 or 1 point it will happen. But I was astonished to see the report after 2 weeks. It became 2.3. Thank God and thank science of Ayurveda. So when this is happening, she was telling me, doctor, I am finding for my first time in my life such a doctor. According to her, I am a doctor with so much difference from what other people are doing. So every SPBA doctor might be experiencing such things in their career, I'm sure. Even Hastalamba team, they are doing such a dedicated service 24/7 without expecting anything in return. So you can imagine the real, this is about what you call 1/4 of what we have understood, right? The potential
Yes,
of
ma'am.
our brain. How much is yet to explore. So we have
This
to
is the
come with
real
the
peace
right
of
attitude.
mind, ma'am.
Yeah, exactly. Do you have anything to talk there? Yes. Welcome to talk. No? Your words will be also beneficial.
Okay, ma'am. Ma'am, as we are discussing about pandemics or management of pandemic diseases, so there is a regular saying in Kerala, as in the old time, it was not possible to cure diseases like plague, cholera, and hence so many people are dying. At this, at the time of epidemic or pandemic, uh, uh, outbreak of cholera is there, no, and many people are dying. But why there is? But so if Ayurveda is having potential, or Ayurveda can able to treat the diseases, then why we are not treating the diseases by Ayurveda?
During that time, right?
Yeah.
You meant that time. Some initial olden times when before the British came, there was no family planning also in India. There were like every parents will be getting so many children, like 16, 17 children, and many
Hmm.
childhood deaths were so common. And also children were used to get, because individual care will be less, might be less. Maybe that is why children used to get so many different kinds of infections. Like during that time in Kerala, there was cholera outbreak was there, cholera outbreak. My
Hmm.
grandfather, my father even remembers that period, cholera outbreak happened.
Okay.
So during that time, there was modern medicine, because after the British came only, so modern medicine was mostly in use. But along
Hmm.
with that, Kottakkal PS Warrior, PS Warrior, you know, Acharya PS Warrior.
Hmm.
So
Yes,
he
ma'am.
used to give one medicine by going home to home. During that time, medicines were also not available. So people had to collect herbs and prepare decoctions at home. That used to be a tedious effort for the people also. So he used to give a medicine, but at the same time, he also wanted to integrate with modern medicine. So there was a kind of integration happening. I don't know why. Maybe the reason is that
Hmm.
there
Hmm.
never used to be any authentic efforts to emerge objective standards in Ayurveda for diagnosis and treatment. If at all it is there, I would say such kind of works are seen only in the works of late Padma Bhushan, Vaidhyabhushanam, Raghavan Tirumapad sir. He had written such a big, tremendous contribution. His contribution is towards Ayurveda, because he had been constantly insisting, emphasizing about the necessity to practice standardized clinical decisions, and also to practice by the minimum medicines with scientific nutrition. He was the first Acharya, or perhaps the only Acharya I have directly come to know in my whole life. Uh, like that, he had some objectivity, he had some clarity. You will be astonished, Sonal, to read his publications. Like, we are encouraged to think to the maximum level, deepest level, when we are reading. Unfortunately, most of his publications are in Malayalam. I don't
Hmm.
know translations are there in Ashtanga Sangraha and all. In BAMS, I used to learn Ashtanga Sangraha, his version only. When you are reading a particular context, you will come to know everything regarding that context, all the other references in other samhitas, everything. And he will be explaining it in a simplest manner, which is conveying realistic way. That is he's a real Acharya. So such Acharyas were very much less, is what I feel. Because I have seen only this publication in my life. And if at all it is there also, there had never been an, what you call, an honest effort to emerge objective rational standards for diagnosis and treatment in Ayurvedic education. That should emerge. Then only the students feel that they are doctors. They should learn
Yes, ma'am.
irrespective of their IQ, right? Some are having high IQ, some are having low IQ, but it doesn't matter. They are all meant to be doctors. They are qualified in entrance. So there should be some objective methods to enable them to train a systematic, collaborative way of diagnosis and treatment. Such kind of treatment is first introduced by SVB. And I'm sure Vaidyamushnam Raghavan Tirupati sir, he might be blessing us from heaven because that was his dream to happen. That is what I always think. Whenever I think of him or whenever I look at his picture, I feel a sort of blessing because this is what he was aspiring to achieve. He used to tell that there is no scope for integration. There is no scope of integration of Ayurveda with modern medicine because both are entirely different objectives. One is blocking, masking, suppressing, altering. Other one is only reversal of cause mechanisms, right? Underlying objective itself is different. So this kind of education was not there. So people had to, there was uncertainty. Definitely when rationality is not there, uncertainty is there. Amodha bhalam apnoti. Yad amoha nimittaji. Right? When confusions are removed by science, only people can be confidently practicing. So maybe people are not confident enough in those times, 5 years. If at all anybody is confident, they might be doing alone, but still. So people had to, and that time British was very active in those periods. So British were compelling, maybe like COVID period, what we have seen, they might be compelling everyone to go for this and such. But the main reason what I find is two: one, joint families, individual healthcare was less, and two, Ayurveda not emerging as scientific medicine, rational medicine, no objective standards of diagnosis and practice, educated for doctors. These are the two reasons why still Ayurveda doctors are staying diffident at the time of the pandemic.
Okay. So, ma'am, as you explain, Ayurveda is for everyone, means Alpa Buddhinam Vyavharaya, Buddhimattanam Anuprartha Jnanam.
Correct.
No?
Exactly.
But ma'am, why Ayurveda is mentioned in alternative medicine and not in mainstream medicine? How can we save money of government by...
I think that part is answered already. How can we save government?
Yes, ma'am, but you want to elaborate if you can.
Actually, the first part is what alternative medicine, right?
Yes,
Because we allowed ourselves to. That's why the reason, Sonal. We have allowed ourselves to be addressed as alternative medicine. We have allowed ourselves to be addressed as traditional practice. Then how can we expect a change? We ourselves are the reason, no?
Yes,
We are
ma'am.
allowing ourselves to be okay. Alternative medicine, Canada, I am ready. Germany, Italy, I am going to Italy. Facebook photo will be posted. Going to Italy for attending traditional medicine seminar. One Ayurveda professor will be posting. It means that Ayurveda is alternative medicine. He is conveying for generations that wrong message. So how can we change? We can change only by doing and showing the right things. We have to do and show, not show and do. If you show merely, it will be show off only. We must be knowing what we have to do to emerge Ayurveda as an independent medical system in the country. We should give a proposal to Honorable Prime Minister, respected Prime Minister. Ayurveda is not considered as traditional medicine or alternative medicine. If we are given an opportunity, perhaps 1 or 2 hours to you, perhaps it will be easy to convey to Honorable Prime Minister than to Ayurveda people. That's what I believe. If we are getting an opportunity to just demonstrate a few cases we have handled and we are explaining things, perhaps he will be understanding most. That's what I think. It's very difficult. Once you get wrong knowledge, it's very difficult to change. People are calling me anti-Ayurveda. Anti-Ayurveda.
Ma'am, unlearning is most difficult than learning.
Very
Unlearning is
difficult.
most
Unlearning
difficult.
and relearning means it requires some receptivity.
Hmm.
When there is no receptivity, there is no change. We are stagnant. There is no questioning, nothing. So that ego is very much high. So how can we change? So alternative medicine, first of all, Ayurveda doctors are defeated. That's why we became alternative. Second, modern medicine acquired monopoly. Ministry of Health. Ministry of Health is determining everything. What should be done in fever, every public policies, public healthcare policies. They are dominating. Why they are dominating in India? Every system should get equal opportunity. No, we all are
Yes, ma'am.
qualified in entrance. Perhaps their rank is 600, my rank is 1200. That doesn't make any matter. During that entrance time, what you did accordingly, your rank will come. That doesn't mean that my system is inferior or his system is superior.
Superior.
Every medical system in India should be given equal opportunity. Recognized medical systems in India should get equal opportunity. When a pandemic comes, every system experts should be called upon by Prime Minister. There is nothing like one system alone approach. That is very, very, what do you call, and unconstitutional also. It is unconstitutional and anti-scientific. I will call it anti-scientific, not
Yes, ma'am.
unscientific. It is a kind of terrorism, what happened. I'm very sorry to say this, but this is the reality. So that kind of monopoly will be not there if modern medicine policy makers understand, like, there should be equality. Equality is something which is approved in Constitution of India. Otherwise, Ayurveda should be banned. Easiest way. If government thinks that Ayurveda is not worth to be practiced, they have to ban the system. It's not like halfway, one leg in the boat and one leg in water we are standing. That is not a fair way. It is unfair to students, unfair to patients, unfair to practitioners and faculties. There should be a big change
About
happening.
Dorminto.
Yeah.
Yes, ma'am. The next question is Ayurveda scope limited to home remedies, cosmetic businesses, and for chronic condition only. Is this true? According to you, what is the biggest lacuna that Ayurveda is not the first preference in acute condition?
Yeah. Actually, the thing is that when you are not confident in doing what you are intended to do, what you will do? You have to survive, right?
Yes,
Being a
ma'am.
doctor, you have got a qualification, medical qualification, BAMS or MD perhaps. You don't know how to treat patients confidently. Suppose a child is brought to you with seizure and fever or something else, acute condition, even a stomach pain perhaps. If you are not confident enough, you cannot treat. But at the same time, you will have to survive for your livelihood. So you will need to think about some alternatives which are easy for you. No need to study, you can do anything as there are no standards. Then comes cosmetology, beauty therapy, right? Massage therapy, any other therapies, hair therapy, skin therapy, all these therapies will step in. It is easy for you, you or me, whoever it is. I can open a skin
Yes, ma'am.
clinic, hair clinic, beauty clinic, and I will do the exact things what is happening in a beauty parlor. I will do the same
Yes, ma'am.
things. I will just make one difference. I will put an adjective before. In beauty parlor, you will get facial. In Ayurveda clinic, you will get Ayurveda facial, Ayurveda manicure, Ayurveda pedicure, Ayurveda
Yes,
facials
ma'am.
and other massages, rejuvenation therapies. So you will earn money because people want Ayurveda means no side effect. That's what people believe. So people will rush to you. You are an Ayurveda doctor, cosmetologist. So people will come to you. So all this happens, and we know that authentic Ayurveda doesn't recommend you to practice as a beauty practitioner, right? Authentic
Yes, ma'am.
Ayurveda is asking you to reverse diseases and stabilize health. Medical science objective is not beauty. Medical science objective is reversal of disease and what do you call? What are the two objectives
Establish
of
health.
Ayurveda? Swasthasya
स्वस्थस्य
swasthya.
स्वास्थ्यरक्षणम् आतुरस्य विकारप्रशमनं च.
Right. No beauty treatments are advocated. So these things, so many different kinds of clinics are opening like this. opened by Ayurveda doctors. This happens because, and many Ayurveda lady doctors, they are going to agencies. And many people used to tell me, ma'am, it is very pathetic. We have to meet the targets there. They will give you target. That business owner will give you a target. You have to make this much, attain this much profit in this month. You have to ensure that this many medications are prescribed. I know such doctors, young doctors who have told me this matter, especially lady doctors. They want to go and practice. So they will be ready to practice in these agencies with lot of frustration. Though they do not accept that, their livelihood matters. So these things can change only when there is authentic learning, authentic training to become a scientific practitioner, authentic policies to support and sustain opportunities. More opportunities are to be provided in government service as well as private. Once you start standing on your own feet, when somebody is telling you you have to make the target, you can tell directly, I'm not ready to work for the target. I'm a practitioner, I'm not a businessman. I cannot meet your demands. I'm not ready to work for that. And he can, number two, he can give quality service wherever he is working and attract more patients. So he can demand the what you call payment he deserves. He can demand, I want this payment, then only I am ready to work. Because I am doing scientific practice. I am a qualified practitioner. I am not a traditional Vaidya. And number three, these disposing staffs, medicine dispersing staffs, they are also treating. So such conditions happen, you should be ready to challenge that, right? Now medicine dispensing staffs are treating, they are giving medicines. So such things are not checked by, there is no law to control all these things. So anybody can prescribe any Ayurveda medicine, OTC also, anything, any site, whether authentic or unauthentic. Anybody can sell anything as Ayurveda. That is the condition. There is no rush. There is no clinical audit. Clinical audit should come. Then only this situation will reverse. Otherwise, India will be like this only for the next 50 years also. There will be no change.
Ma'am, how students get confident if they are not treating the patient or if they are not exposing to the patient? How can they become confident to treat the diseases? So this is a lack. Yeah, ma'am.
Main problem, no. Patients are there only. When patients are there only, faculties will be able to treat. When faculties are confident, only patients will come. Otherwise, patients will not come. In Gujarat, while I was working in a college, one day actually there were many cases. I was posted I was having a regular OPD there, and I had a patient. I was referred a patient by the principal of that college. Diabetic. He was having diarrhea, diabetic diarrhea. He used to get 16 to 17 times motion a day. 65, 70 years old patient. 16 to 17 times diarrhea, loose motion. So he referred him to me, the principal. Principal told, you can take this patient, you can help this patient to be stable. I thought, okay, it's a very good case, I will take it. And I started doing SBBA guidelines. And second day when I went for rounds, it was on Friday I started, Saturday and Sunday over. Monday I went for rounds. That person, initially he was lying on the bed always. He was sitting on the cot and waiting for me with a smile. His wife was standing beside. So I understood things are better. I have started our SBBA ORS, SBBA restabilization therapies along with diabetic treatment. Only SBBA principles and one medicine scientific diet approach with ORS, Ayurveda, SBBA ORS. I have started, and the patient told me, I will still remember, doctor, after a period of 15 years, 14 to 15 years, I got a formed stool today, formed stool output today. So I'm really happy for that. Formed stool output after 15
अच्छा
years.
2 मिनिट थांब.
So he was on anti-diabetic medications and insulin for long period. he was having not extreme tiredness. You can imagine that much number of bouts of stool output means you can imagine the level of tiredness when he was brought to our hospital. So I became happy. Am I audible? Something went
Yes,
wrong,
ma'am.
I think.
Yes, ma'am.
Okay, fine. Okay. So this I wanted to report to principal, and and that also his fasting blood sugar after stopping all the modern medicine for 2 days. It was 98. Fasting blood sugar was 98. In the lab, he did that also. So because of these two reasons, he was very happy. After 2 days, no modern medicine, no insulin, nothing. And I went to report this to principal. And principal, you know what he told me? Who gave you the right to stop modern medicine for diabetes? Did I ask you to stop anti-diabetic drugs? He was asking me this. When I reported all these conditions with the lab report, he was happy, his wife was happy, and he, with actually a good thing I wanted to report there, and he told me, who gave you right to stop modern medicine? You have no rights to stop modern medicine. Then I told sir, then I don't have such rights to do Ayurveda along with modern medicine also. I don't know such a thing where I can include Ayurveda with modern medicine. Sorry, I'm not qualified in such a system where incorporating modern medicine and Ayurveda is done. I'm not trained. I'm not qualified in that. So please excuse me. Are you sure you don't want the patient? I told I'm very sure I'm not going to take this patient anymore. And after one day, Sonal, next day when I was standing in the prayer hall, his wife was waiting for me behind a pillar in the college. And after I was about to go to my department. His wife came to me and she was crying. She was telling me again, they started all the medications back. He's having stomach pain and he's very upset. We are ready to take discharge and go home and come to you if you are allowed to consult at your home clinic or anything. That time we were not having permission to to treat outside. So I was not able to help the patient. I told, I'm very sorry, I cannot do anything because he was given Vasti also on the previous day. Just imagine, along with modern medicine, Vasti also. So that is the condition, what is happening in Ayurveda colleges today. How can we help people if we are not allowed anything, if we are restricted? I have heard that PG scholars are not allowed to stop antihypertensive drugs during hypertension study. Not allowed to stop. Ethical committee clearance will not be there. Who is this ethical committee? Ethical committee is comprising of professors who are qualified in both Ayurveda and modern medicine together. Is there any course like that? Who is an expert in integrated Ayurveda modern medicine? On what basis they are not giving clearance to give standalone treatment in research in Ayurveda? That's what Sonal. So Ayurveda has to be banned. Ayurveda cannot be mixed with something else. Then it is not Ayurveda, right? It is not Ayurveda. It is Ayurveda plus modern medicine. One new course is to emerge. Otherwise, this is cheating, not treating. That is my opinion. It's
Yes,
very
ma'am. That's
bad
why
and
students get. Yes, ma'am. That's why students
so
get confused. No.
yeah, students no use because faculties are not confident. They will do no fever, no fever cases to be admitted, no diarrhea cases. Let arthritis case comes or back pain case comes or cerebral palsy cases come like that. Doing some endless Panchakarma therapies and
Panchakarma.
doing everything. And PG scholars and students they are not getting any idea what is being happening here and what kind of impact is happening in the patients. Acute cases, no cases are coming. If at all coming, they will be given 5 kashayas or 3 kashaya mixture. During my BAMS, I used to see one hypertension comes. We don't need to study the patient even. Hypertension means Ashtavarga plus Gandharva Hastadi is the yoga for hypertension. Whoever comes with raised BP, it is fed in the brain.
Same treatment.
Nothing to study. Ashtavarga with Gandharva Hastadi. That should be given to the patient. It is like a rule. No change. No thinking, no culturing of intelligence. Shastra Artha Karmanushīlanena Samskurveda Pratyam is what Acharya says. Here there is no Shastra, No
No
Shastrartha, no
Shastrartha.
Shastrartha Karma, and no
Karmana.
Anushilana.
Yes, ma'am.
So it is uncertainty.
Yes, ma'am. Only this much questions are there. So, shall we conclude the session or?
Yeah, of course. Why not? I hope people might have benefited, and if they have any questions, let them ask. Under our this talk will be
Hmm.
left there. No, today's talk
Yes.
video.
Uh,
I hope that video will be available on this page, right?
yes, ma'am.
Okay. So if any questions, anybody can post it. We can answer it.
We'll wait for a minute.
Or else later also, no problem. If no questions, later also.
It was a great session, ma'am,
Thank
and
you.
really helpful.
Thank you.
So, shall we conclude?
Yeah,
Okay.
sure. Thanks, Sonal, and you have done a great job today.
Thank you,
The
ma'am.
questions were so precise, and you have managed time also very well. Let's hope we help
Thank
the
you, ma'am.
people at least to a small extent,
Yes.
and we continue such sessions in future also for the sake of people.
Yes, ma'am.
We
Thank you.
can request for their topics suggestions also in future.
Okay.
Okay,
Thank you, ma'am.
Sonal.